Hello and welcome to the For Parents Like You podcast. My name is Hilda-Joy O'Connor, and on this podcast, we will be talking about all things to do with parenting. Being a parent is one of the most important roles you can ever play in the life of another human being. Let's be honest, there is nothing more fulfilling than to see our children grow up in love, compassion, and empowerment. But the process of getting them to this stage can be very difficult. On this podcast, we will be discussing ways of how to equip parents like you and me to become more effective and purpose-driven. Thank you so much for joining me as we dive into today's episode. August is Breastfeeding Awareness Month, and breastfeeding will be our main topic for this episode. And joining us on this episode is Fran Bartz, who is a lactation consultant and who has great experience and knowledge in this area. Fran, welcome and thank you for joining us today.
Thank you very much. Glad to be here.
Now, many moms struggle with breastfeeding. And as a result of this, they're easily prone to give up in the beginning and result to giving their children formula milk. For me, I breastfed all my children, and I've seen such a great benefit in their development as a whole. Matter of fact, I am still nursing my youngest child, Joshua, who will be 13 months old in 2 weeks. Now, I must confess, my journey of breastfeeding wasn't so easy or smooth sailing in the beginning. I remember with my first child, Naraya, I struggled to latch her on properly and she lost a fair bit of weight in the beginning. And I remember I was so engorged to the point where I nearly gave up to continue nursing her because of the intense pain I was going through. But however, for my second child, Josiah, I found breastfeeding him so much easier and smooth sailing. But with our last child, Joshua, again, I struggled as I did with Naraya, but with him, he lost a lot of weight to the point where he had to be readmitted back to hospital so that they can keep an eye of his milk intake. And I remember that he had to use formula as well as breast milk. So he was basically having mixed feeds. Thankfully, I was able to see a lactation consultant who was able to direct me on basically how to latch him on properly and how to help with my milk flow so that he's able to get a lot of milk. And so thankfully I persevered through and he's off from the formula and he is exclusively breastfeeding. I haven't had 2 children yourself, Fran. Did you have any troubles breastfeeding your children?
Yes, with my first child, I had basically the medication given IV that is used to induce. And so when he was born, he probably had a lot of that fluid in his body. And then when it came to the 5-day check, they said, oh, well, he's lost too much weight, so you need to start giving formula to help us. And here's, the phone number for some folks that will help you with a hospital grade breast pump rental to help you get your breast milk supply going. So that was pretty devastating for me. And also he was in special care because there was meconium, that first poo, in the waters when he was born. And so they wanted to make sure that he was doing okay because his breathing was a little fast, which meant that I couldn't feed him because they were giving him oxygen in his nose, and then they would put a tube down his throat so that his tummy wouldn't inflate with air. So, it was a bit of a rough start for us. And fortunately, the area that I lived in at the time, he was born in the States, I was able to access support to help me breastfeed because I was a woman on a mission to get that breastfeeding going, and that I could do it, and that I didn't need anything else, and that so it was a bit of a struggle. And with my second, I had already joined the charity that I now volunteer with, which is called Leche League, and leche just means milk in Spanish. So there's 4 charities that do breastfeeding support in the UK, and Leche League was started in the States, but now it's global. And so, with my onward journey with breastfeeding with my first was supported with that group. And then in the course of being with them, I decided that I wanted to work with people, supporting them in breastfeeding. And so I became a volunteer counselor for breastfeeding support. And so then by the time that I had my second, I had a lot more support and was able to, and had a lot more confidence in, knowing who I could reach out to if I had any difficulties.
What really encouraged you to carry on and to persevere through with breastfeeding your first child? Because, you did struggle a lot, didn't you? And some people may have given up, but what kept you going to persevere, to fight through that you will actually do this and continue to breastfeed?
Yeah. It's one of those, multifactorial things. I mean, I've read a lot about breastfeeding, and so that I knew, so many good benefits for children and for, mothers as well with breastfeeding. It can prevent cancers in both mothers and children. It can long-term feeding, and also it can help with asthma and obesity and that sort of a thing, and diabetes as well. And so I'd read a lot about it, but we live in a society, both in the US and in the UK. My second was born in the UK, where we're not used to breastfeeding anymore. When the charity that I work with was started in the 1950s, women were told by their doctors that breast milk was bad for them. And,
wow, really?
That's silly.
Really?
So they banded together and said, no, this is what's right. This is what our bodies were made for. And then they got, good solid information behind them, and they supported each other. And so the heart of it is women supporting other women empowering women to be able to do what it is that they want to do that's right for themselves and for their families. And so from the beginning, they had physicians with strong solid information about infant feeding working with them to make sure that the information that they were sharing was up to date, current, correct, scientifically evidence-based type of information. And then coming forward to the future, or coming forward to where we are today, World Health Organization recommends breastfeeding your child for 2 years and beyond. What that looks like for each person and each family might be different, but it's definitely something where that's evidence-based information, and the Leche League consult with and are consulted by organizations such as the World Health Organization, because the information that they have access to and provide is solid information.
Wow. Okay.
So, but working through all of that sort of a thing, but also it's just, you're a mother and you have this baby and you don't necessarily realize it when you're pregnant, but when you get that baby and they hand you a baby and you're like, oh my gosh, I've just made this baby. And so far this baby has survived on my body alone, and my body was made to support this baby's life on the outside as well with my breast milk. And so, there's that sort of, head and heart sort of divide there, but that's in my head. I know that scientifically it's good for them, but in my heart, it's also, this is what I need to do, what I have to do for my child. So it's just, my husband was, you were a woman on a mission, and it was, you didn't mess with you. You knew what you wanted and you were going to go for it, and there wasn't anything that was going to stand in your way. And so I was just like, okay, well, let me cook you some dinner, and let me cook you some lunch, and let me bring you this, and let me wash that for you, and so on and so forth. Because, it's mothering, and it isn't, breastfeeding isn't just the milk coming out to the baby. It's antibodies, it's love, it's nurturing, it's oxytocin, that love hormone. There's all sorts of stuff going on. It's not just a baby having calories for nutrition.
That's right.
And so that also, and it takes time. I mean, some people, their baby is born and they're like, oh my gosh, this is the best thing ever happened to me. I love this baby and it's never going to leave me. And then other people, it takes, a few weeks for them to, just all to sink in of, oh, wow, that I'm a mother and this child is depending completely on me and I love it to bits. It's just, the journey is different for each person. And so you just, there's all this head and heart stuff that's going on, because after that baby is born, it's one of the most significant things that happens in your life. And then they say, here you go, see you later. And you're like, oh, what do I do? So it's important to have support for doing parenting, breastfeeding, and all of that. I mean, you can't, one of the sayings that's really been important in the US, and I'm not sure how it is in the UK, is it takes a village to raise a child. A child doesn't just a mother and the child and that's it. There's family members, there's neighbors, there's, religious leaders or someone, whatever it is. There's all sorts of people in the community that are there to help a mother and a child to raise that child. And so sometimes you need to seek out that support. It's not necessarily just going to land in your lap. You are the only person that knows you and your baby the best, and you need to advocate for yourself. So there are different levels of experience and expertise and training for people who work with breastfeeding. There are those who are called International Board Certified Lactation Consultants. Those are people who have had 5,000 hours of experience, along with taking a course and sitting an exam, and then having to, requalify every 10 years, make sure that they have continuing education. What I do is volunteer work, so, mine is more sort of the more common experiences and troubles and difficulties and normal newborn behavior and normal child behavior, but also the counseling aspect of it. Because sometimes there might be someone who really, really, really wants to breastfeed, but they haven't got support from their family. And so then you can be a person in their corner to say, well, here's some information. This is how you might want to go about it. And then you give the information to the person, and then they decide what to do with it and how best it will work for them and their family.
Yeah, you really helped me with that, especially with Joshua. When I was having difficulties with him, you came and you helped me as well and showed me what to do before we were admitted back to the hospital. So I really appreciate that. But I've always wanted to ask this question, but I don't really know the exact answer. And I believe that you may. Can all moms breastfeed?
All mothers can breastfeed. Not all mothers can fully give their child nutrition from the breast. However, most mothers can breastfeed directly from the breast without huge difficulties. There may be difficulties, whether, it's rough starts or rough middle bits or rough end bits or whatever. But there is support for that. And there are ways of going about it, reaching out to a health visitor, reaching out to the charities, reaching out to infant feeding coordinators at a hospital if you're admitted. In this country, physicians and GPs are generalists, so they don't necessarily have knowledge about what's normal newborn behavior. So when a baby is feeding in the evening, they're like, I don't know, maybe the baby's hungry, give them formula. And you're like, no, that's just normal behavior, and baby's just trying to figure the world out. And by the end of the day, they've had it. And that's just called cluster feeding, and it's a phase. A lot of phases seem to last forever, and they do pass, but it's also nice to know that you're not the only person out there that that's ever happened to, and that it will pass, and there are ways of coping with it. But if you don't know anybody who's breastfed, I mean, a lot of people, when they have their first baby, they've never even held a baby, changed a nappy, anything like that. And there's this big focus of preparing for the birth. And it's like, okay, that's a one-off event. But being a parent is a lifelong event. I mean, that's the life right. of that child. So, you know, and what we do is we do the breastfeeding aspect of it, but there are also other things that follow. You know, understanding the child, you know, that the child has needs and that sort of a thing. You know, we have that Victorian idea that, you know, children should be seen and not heard. They're humans as well. They have needs and feelings and that sort of a thing. And so how can you best let them express themselves and, you know, fit it into the needs of the family? Or starting solid foods, or when people are returning to work, you know, I'm the only person who can get my baby to go to sleep and they're 10 months old. Yeah, but, you know, other people have to find a way, and they do find a way. It's just a bit nerve-wracking when that happens for a lot of people. And, you know, fortunately in this country, we have, you know, 9 months to a year of maternity leave. In the States, it's not necessarily that way. It's 12 weeks unpaid.
Wow.
When I was as I was in the U.S. military at the time that my first was born, and at that time, the maternity leave was 6 weeks.
Really? So, just 6 weeks, and that's it?
After 6 weeks, I went back to work. Fortunately for me, my boss was very understanding, because I was like, okay, I'm going to come back to work and I'm going to pump and I'm going to do this and I'm going to do that and blah, blah, blah. And he was like, you just had a baby. I lived really close to where I worked. And he was like, go home, take care of the baby, come back, it's fine. And it was, you know, and so I would have breakfast around 7. I would express milk while I was eating my breakfast. I would go to work and my husband would feed the baby the milk that had been expressed at breakfast time. When he woke up later on, I would go home at 9 o'clock in the morning to feed, at 12 to feed and also to have lunch, come back at 3 o'clock to feed, and then finish work at 5. And, you know, it worked out. And then my husband came back to the UK to start work when my son was 5 months old. And so he was at a childminder, but the childminder was similar distance from my work. But I still had that same pattern. And then, of course, around 4 or 5 months, babies sort of come out of that 4th trimester and start getting interested in the world. And breastfeeding during the day is a bit too boring. There's other things to look at. And so then I would, you know, I'd be missing work for him to just be staring around into space saying, hello, nice to see you. Can we play now?
Maybe he missed you during those times that you were at work.
Only about 3 hours.
Well, 3 hours to baby is a long time being separated from his mum.
Yeah. Would you just feed so I can go back to work? I'm missing work for you to not feed. Come on. So,
wow.
Yeah. So then I would finish work and then he would feed and 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 feed. I would take him to the childminder in the morning and then we would do it again. But that was really hard too. And fortunately I was able to call my mom and have her come and stay with us so that, you know, she could take care of. I couldn't even cope with taking the bin out. You know, it was just, this baby is attached to me from the time I get home from work until I leave for work in the morning. So she was able to, you know, make sure that we were fed and the dishwasher was emptied and what have you. So I was really fortunate, and you know, not necessarily everybody has that, but I'm grateful for the support that I was able to get.
You mentioned earlier on that mums can breastfeed. However, they may not necessarily have the nutrients that the baby needs. What sort of nutrients does a baby need that some mums may not be able to provide?
Well, kind of what it is that a mom might have a medical condition that means that they don't have enough glandular tissue And so that might be someone who has polycystic ovary syndrome or PCOS. That might be someone, there are a few endocrine disorders like that one, that might mean that they don't have enough breast milk making tissue to be able to fully breastfeed their child. So it's not that they're missing nutrients, it's just that their body doesn't make enough milk to feed the baby. But that doesn't mean that they still can't nurture their baby at the breast, that they can't use some other way of feeding the baby, whether it's spoon feeding a supplement or finger feeding a supplement, or there's something called a supplemental nursing system, which would be a container of some sort, whether it's a bag or a bottle with a teat that's snipped off with a tube running, so that the baby is feeding at the breast, but still getting all of the nutrients they need, either from, formula, donor breast milk, expressed breast milk from the mother, whatever it is, to get the baby as many calories as they need.
Okay.
But it's extremely rare that a person has a condition like that, and that they can't fully breastfeed their baby, but it does happen.
Okay. So how about if some moms may struggle with postnatal depression? Can they still breastfeed, and can breastfeeding help to decrease this symptom? Or what would you say?
Yeah. I mean, there are many times there are people that have postnatal depression, and they may have medication to treat the postnatal depression or not. They may be using other methods, therapy, that sort of thing, with a counselor, to manage their condition. But most medications that are used for postnatal depression can be compatible with breastfeeding. But it's also, a lot of times with postnatal depression, it's this thing where, I can't, and I can't, and I can't. And breastfeeding is one of those things that is one thing I can do. That can be a very positive thing for a mother with postnatal depression. But again, postnatal depression isn't something that is going to happen to everyone. There's baby blues, and then there's postnatal depression. Baby blues is just this surge of all these hormones going on and your body coming to grips with it, or trying to come to grips with it. And then postnatal depression is something that's a lot more extreme of a condition that not as many people get.
How can women prepare for breastfeeding during pregnancy?
I think taking an antenatal breastfeeding course specifically is really helpful. Especially during lockdown, and since then, we in the Leche League have started offering antenatal breastfeeding courses for free. And every time we offer them, they book up and they overbook. And, it's just a couple of sessions with a few breastfeeding counselors and people from all over the country. I did a practice run with one, and there were people from Yorkshire and, London and Scotland and whatever, all over the place. And, with the beauty of Zoom is that you can be anywhere and do it.
That's right.
There have been, things where, people have been, dads have been stuck in other countries, and they've been able to join on the antenatal breastfeeding course while they're stuck in wherever it is. And so, that's been really special for the dads as well, because at least it's something that they can be involved in. So, as humans, we learn from watching other people doing stuff. And, if you want to learn how to cook spaghetti bolognese, you can look at a recipe or you can look at a YouTube video. Well, breastfeeding isn't quite as simple as, you just watch a YouTube video and it's fine. So we sort of go through in the antenatal course how breast milk is made, and then just the two basic things, which are positioning and attachment. So attachment is how the baby takes the breast into the mouth. And it's not nipple feeding, it's breastfeeding. And so, it shouldn't be painful. Baby should have a good mouthful of tissue in their mouth. How does the milk come out? Well, the milk doesn't come out of the nipple, and is not necessarily, sometimes it comes out on the areola. And so that's why the baby has to have a good mouthful to get cover all of the places where the milk is coming out. And the nipple has to go clear to the back of the mouth, because it just sort of squirts into the back of the throat and gets swallowed that way. So it's just knowing about that. And, like I was saying earlier, we plan a lot for what the birth is going to look like, but you're going to have a baby that's going to need to feed and eat. And it's really helpful to have a lot of preparation and also just know what your support network is and start thinking about your support network and identify the people that, if you do have rough patches, who can I go to, rather than it being the dark of night and 2 o'clock in the morning and you're Googling. It's not a good time. Not a good thing to do.
Should be sleeping around that time, right?
Well, if you're worried about something, you'll be Googling things and it's not pretty. So, yeah, the antenatal preparation of breastfeeding, but also having your support network on board with you and to talk about it with your partner, with your family members, with your friends. And, a lot of people say, oh, you're having a baby, let me know how you can help. Here you go. You can bring us the food on this night. You can help wash the dishes on that night. You can move around because, if you think about it, especially in the early days, the baby is putting in their order for the rest of the breastfeeding journey, that first 6 weeks. And, you are working hard feeding that baby. You may be feeding that baby for 8 hours. You know what? That's a full-time job. You just did, or 12 hours or whatever it is, because that baby's learning, you're learning. And, so you don't have to feel badly that you're just sitting with your feet up watching box sets of this, that, and the other thing on the iPlayer, which you might be. But, it's not like you can get up and move around and hoover and do the dishes and the laundry and make a 7-course dinner and that sort of a thing. You're bonding with your baby. You are starting your relationship with your child. That's going to, it's the foundation for the rest of your lives together. And, sometimes partners will feel like, oh, well, I want to feed the baby and, I want to give you a break and that sort of a thing. And it's well-intentioned because we're used to formula feeding. Anybody can bottle, it's fine. But expressing is a faff. Bottles are a faff. Cleaning it is a faff. And it's just like, no, this is my baby. I want to feed it. You can do everything else. You can do as many nappies as you like. You can feed the baby. You can feed me. You can bathe the baby. You can do the baby's nappies. You can make food for us. You can do housework. That is how partners and family members and support from around. That mother is there to feed the baby. And it's a real mind shift for a lot of people because they're not used to that. They're used to going out and being and doing whatever they want. And there's another pressure in society that you have to get your body back and get your life back. You just had a baby.
That's right. Give yourself a break.
This is your life now. Your life isn't going out and partying anymore. You've already had that chapter. You can do it again when they're 18, okay?
That's true. Yeah, it takes a lot of work. I don't think that not enough people understand that it takes a lot of work on your body to just feed a child. And we as mothers shouldn't put so much pressure on ourselves that we have to do other external things and neglect, the important thing that we're meant to do that is present to us, which is breastfeeding our children. Are you still feeding your oldest?
Yeah.
And he's how old?
He's 5 and 5 months.
And your youngest is?
2 and 10 months.
So talking about the ages, is there a particular age for women to stop breastfeeding or can they just carry on? Because for someone like you inspire me because you're still breastfeeding your 5-year-old, and well done to you for that, for carrying on. I commend you.
Yeah, I mean, it's not a competition. It's what is right for you and your child and that relationship with your child. Obviously he's getting benefit, both nurturing as well as a few antibodies. Once a child gets past about 2 years, they've done a bit of research. Obviously, breastfeeding isn't a very lucrative business, and so there isn't a lot of research about various topics with breastfeeding, nor women's health in general. So breast milk kind of concentrates after they've seen that after about 2 years, breast milk is a lot more concentrated. So the children that are feeding after that point, they might not feed very much or very often, but what they do get is like super juice. They've got the antibodies and that sort of a thing. And so, during times when we've got all sorts of unknown bugs out there doing things that we don't want them to do, at least there's, a little bit of protection in a different sort of way that your body can provide for your child. And so, it's the nurturing aspect of it, but it's also even just, fats and that sort of a thing. There's stuff in breast milk that does not exist in anything else, because while formula milk is usually based on cow's milk, cows are cows. They're not humans. So, what you're looking for to grow a human isn't necessarily what you're looking for to grow a cow. So, but yeah, I mean, it's what has worked for me and for my children individually.
Coming from an African background, for a woman like myself to continue to breastfeed past the age of 2 is like a shame or like a taboo. Because I remember when I went to a party when Josiah was just over 1 years old, and it was so crowded, and he was just hungry. And so I took him out and I just breastfed him. And there was this lady, she was just looking at me like, and just talking about me, but in another native tongue called Yoruba. And I could clearly hear that she was talking about me, basically saying that how embarrassing am I, you know, breastfeeding a child that is over 1 years old. And it made me feel a bit like, oh, a bit insecure and a bit like, oh, is it a problem to continue to breastfeed a child that is over the age of 1? And I think for us as Africans, I think that we need to educate ourselves more about the benefits of breastfeeding, and not put a certain age as to when to stop breastfeeding. I mean, from my understanding, I believe that a child should stop when they're ready, right? What's your
Absolutely.
intake about that?
Um, a lot of times culture can get in the way of reason and under, medical understanding, evidence-based understanding. But we grow up in culture. We have culture around us, and so when you're hearing these negative ideas and negative thoughts, it can be really difficult to deal with. And so having someone in your corner, having someone that looks like you, having someone that has had experiences like you. You and I were talking with a lady who's Southeast Asian, and she was talking about, well, how do you deal with people making comments in a coffee shop and this, that, and she's like, oh no, I've had that. And in the UK, there's racism just from the general public about someone breastfeeding, but they're not going to say it to the white privileged suburban middle class woman. They're going to say it to a person of color.
Yeah. I think that we need to just break that barrier
Mm,
and give people the freedom to be able to breastfeed if they want.
yeah. And, what do you see? You see a breast. Well, you see that on an advert for a bra, Victoria's Secret, whatever it is. But because in this society we sexualize breasts, we can't see breasts as something that's nurturing,
Nurturing, yeah.
mothering. We only think about it as sexual. There have been studies about, hunter-gatherer societies in other places, and you tell them that, yeah, in this culture, men like to play with breasts because, they find it sexually stimulating type of a thing. And the people from these societies are like, those are for kids. Those are for babies. What? That doesn't do anything for me. They're crazy. So again, it's culture. And, how long do you breastfeed a baby for? Well, we kind of don't know because, hunter-gatherer societies, they've got to go out and go and get food. And so then you have taboos in this society about milk from one mother to another mother. And so, in the hunter-gatherer societies, there might be an auntie that, if the baby's crying, well, she's going to feed that baby, and it's not a big deal. But in this society, it's a taboo. And so people, think it's important. But that's just another cultural practice that's different in our society that people would probably have a hard time with. But in other societies, it's fine.
Okay. Wow, that's interesting.
But going back to what we were saying about the early days, it's not lowering it's lowering your standards, but lowering your expectations of what you're expecting you to do. But there are ways of coping. There's batch cooking meals instead of making fresh meals, or how can I plan things so that we cook, we have maybe the same thing for lunch every day for the week. And then for dinner, we might have some stuff that, we've frozen or whatever, so that you sort of get your way through. If your partner works during the week, then maybe at the weekend, your partner can do a few things that can be had during the week and also frozen for later, and then you can swap them out. However, it's, talking with other people and other people supporting you to say, oh, well, this worked for me. And, it might not work for you, but maybe in 2 weeks it might, or, oh, I hadn't thought of it that way, or whatever it is. So it's nice to just hear other people's ideas and then decide what you want to do for yourself.
And like yourself, I also carried on breastfeeding whilst being pregnant. And for some moms, they may think that that's not possible, but it is possible, isn't it, to continue breastfeeding whilst carrying another child? Yeah. How was that experience for you?
So it's officially called tandem feeding. So it's where you're feeding two children. It doesn't mean that you're necessarily feeding two children at the same time. It just means that you have two children who are feeding. And if you're feeding an older child while pregnant, that's still called tandem feeding because you're kind of feeding the other one from the inside and the older one from the outside. But again, because we're not used to it, we don't necessarily know a lot about it. But there is information available. And, a lot of times if healthcare practitioners have never heard of it, they don't really have a basis in knowledge. And so they don't necessarily know what to do with you. And so they might not necessarily give you a good scientific response to what it is you're doing. But, I think the more that people do it, the more healthcare practitioners may be exposed to it. And then, they get more information for themselves. And so then they can give better information to the people that they work with. So a lot of times when mothers are breastfeeding while pregnant, their milk can dry up. And just because your milk dries up doesn't necessarily mean that your child wants to stop breastfeeding, because there's still that nurturing element. A lot of times the flavor of the milk changes from about 22 weeks. So sometimes from about 12 weeks onwards, your milk might dry, you might not have much milk. And then from about 22 weeks is when colostrum is made. And so that's that first milk that babies get before your full supply of milk comes in after baby is born and after the placenta is out of the body. So that colostrum is that thick liquid gold, they call it. And part of what that colostrum is doing is laying down immune factors and sort of lining the intestines and the stomach and all of that, and giving your baby its first good bugs, the good bacteria and that sort of a thing, and protecting your baby's insides with that colostrum. And it also is getting that first poo out. And so it's laxative. And so if you've got the older child that is feeding and starting to get a little bit of milk out, or a little bit of that colostrum out after your pregnant body has converted to colostrum, you might find that what's in their nappy is a little bit looser than what you had been expecting. But it's definitely something that can be done. Some people choose to, some people choose not to. It just depends on what you want to do. Some people find it as a good parenting tool, that if the baby's feeding, well, at least the toddler can feed too, because then I know where they are. They're not getting into mischief. And other people decide, no, one is enough, thank you very much. And so then they transition their child to stop breastfeeding while they're pregnant, so that when baby comes, they can concentrate on baby. But that, like many other things, is a personal decision. There's also something called aversion, which often happens in pregnancy, not always, but it can even happen if you're not pregnant. And that's this sort of feeling while the baby is feeding that the baby is just other and foreign, and that you want to get that baby off of the skin might fall, that sort of thing. It's important to name things, so then you know how you can deal with it. And so there are support groups of people who specifically have aversion. And then there's another whole thing called DMER, which is dysphoric milk ejection reflex. That's what that stands for. And so that's when you have letdowns, you just have this awful, terrible feeling, which isn't quite the same thing as aversion. I just want to get that baby off. So, if there is someone who has breastfed and they have had some of these feelings, it's important to talk with someone that has information about, knows about breastfeeding and breastfeeding support. Because if you talk to any old GP about DMER, they'll be like, "What's that?" Because they don't study that depth of breastfeeding and that sort of a thing, unless they have had someone, a patient or someone in their family who has had that happen, that condition. So if there are difficulties, it is important to reach out, to know, to find your support network, phone a helpline, whatever it is, that you're not alone, and that most of the time what is happening has happened to someone else. Yeah. And that there is someone available to speak to you to be able to work out how to cope. And, baby feeding for 12 hours a day, there's other people that have had that same thing. And so what tips and tricks did they use to be able to cope? It's really hard to, you can make a cup of tea kind of one-handed, but buttering toast is really hard. So, how did you get around that? And so, maybe it was using a sling, and, then baby's with you and you can make yourself a cup of tea, but you're not going to be sitting there scrubbing toilets with babies and a sling. I hope. Maybe you do. Maybe that's what you need. Maybe it's what makes you happy. And, and that's another thing is you kind of, if you want your floor to be hoovered, because that's what makes you happy, and that you sitting there feeding all day and your floor not being hoovered, you got to let that be known, and maybe it's you doing it, but don't make yourself crazy about it, because most of the time there's not going to be very many people that are going to come over to your house and say, oh, your floor hasn't been covered.
Yeah. Yeah, that's a good analogy.
Health visitors have seen it all, and unless there's really bad things happening, they've seen it. And they've probably seen the really bad things too. And that's the other thing about health visitors, is they can sort of be a good person to go to sort of say, this is what's going on. Not sure how to cope with it. Is there something you can do to help me, or some way, can you signpost me to something that would be helpful? Because health visitors are basically public health nurses. They're making sure that babies are growing properly, that they're well cared for, that it's a safe home. Kind of beyond that's not really in their basis of knowledge, and that if everything is going fine, there's probably some other family that needs them a lot more intensely. And so there's other ways of getting support for the things that are fine. They just are bugging you, type of thing. So, know what health visitors and GPs and other people that you come into contact, breastfeeding supporters, lactation consultants, infant feeding coordinators, all these different things. They have different areas that they cover. And so being able to reach out to them, but also knowing what the different things are, is knowledge going forward to be able to do whatever it is that you want to do.
So basically, just don't suffer in silence. Seek the support that is available to you.
Lactation consultant, if you're in hospital, an infant feeding coordinator, GP, whatever it is. But know that there are some people that don't have a lot of information, and that there are some people that have more information. And trust your instincts, because you know yourself and your baby the best. And if someone tells you something and you don't think that sounds right, okay, search, dig a little deeper and look for someone else who can help you, type of a thing. And, that's true for anything. And also, if there was an intervention, or if you had something happen in pregnancy, say you had gestational diabetes, or you had the baby early, or you had forceps, or whatever, make sure that you mention that every time you're talking with someone. It may or may not have an issue with whatever issue it is you're bringing to them, but they're not going to have what it is that happened to you that may have been a little bit out of the ordinary right in front of them. And so mentioning those things may trigger something in them to say, let's check this out, to make sure that everything is okay. I talked with someone this week, and I was talking about positioning, because she started to have mastitis. And so she just jumped on all the things that she had read to do to try and make sure that the baby was taking the milk out, and massage and compresses and all this stuff. But she was really scared that it was going to happen again. And she was like, so what do I do? And so, we just go back to positioning and attachment, like we talked about when we do the antenatal course. That's the basics of, well, baby's 6 weeks old now, and did you have a difficult time at the start? Yeah, we had a really difficult time with Leche at the start. I've probably been a bit lazy, and this is how the baby feeds, and so on. And so I said, okay, well, let's go back to that, and let's see if that will help you make sure that the baby feeds well, feeds deeply, and that it's not causing problems for you and your breast. There are some people who are prone to mastitis, some people whose breasts leak when they're breastfeeding. There are some people that, each experience is different. Each breast is different. Each breast and breastfed child is different. We have a mom who has triplets, and she breastfed the triplets and she breastfed the older child, Tandem. So she was feeding 4.
Wow, that's a lot.
Yeah. And she's like, the fourth, and the older one, well, might as well, everyone else is. And so that triplet mom was able to feed her babies 80% with her own breast milk.
Wow, and that's incredible.
20% was top ups with formula, but they're beyond a year now, so they don't need that stuff. So, but she would say, triplet A, she read that book. She read that book that she feeds. She goes to sleep for 4 hours. She wakes up, she feeds again, goes to sleep for 4 hours. Triplets B and C, they didn't read that book. They would feed, go to sleep for 40 minutes. They would feed, they would go to sleep for 40 minutes. And, but each breast is different too, because we're not symmetrical. So you might have a good breast and a better breast, or a bad breast and a good breast, or a bung breast, just each breast is different, and how each baby feeds from it is different. So just, knowing that sort of a thing is really important and empowering, but we don't learn it in school. We don't learn it from our family. We don't learn it from our friends, because they give you a baby and you go home by yourself, and that's it. And that's because, we're not sitting around, in our villages in a campfire, sharing our food and sharing our stories, and, seeing aunties breastfeeding from when you were, teeny tiny all the way up, growing up, learning about how it all works. You go to school, you get your education, you start working, and then all of a sudden you decide, oh, we'll have a baby. That's not the same as seeing it from the very beginning.
So if one wants to connect with you, how can they find you?
Okay. So the national organization is La Leche League GB, or LLLGB. You can Google that. Here in Hertfordshire, we have a group in Hertfordshire with a few of us that volunteer. And so, again, La Leche League Hertfordshire. And we can, we've got a Facebook page where we post information. You can contact us by Facebook Messenger. We've got a phone line that goes to our voicemail, and you just leave us a message and we can ring you back. And then this, we have a national helpline. It's all womaned by people who are volunteering their time and have children and families. And especially in the time when, we're not really going out much, we've got our children with us. And so we might not be able to answer the call when you ring, but if you leave a message and say, this is what's going on, there's people that are quite happy to ring you back and talk with you about it. There's 4 different charities. There's NCT, which a lot of people may have done their antenatal course. There's, I think, a little bit of breastfeeding in there, but it's more birth and caring for a baby and that sort of thing. Association of Breastfeeding Mothers, Breastfeeding Network, that's the charity that has done a lot of work with medications used while breastfeeding. And then ours is the Leche League. Little story about the Leche League. It was started outside Chicago by a group of mothers that met at a community picnic. And, they said, oh, you're breastfeeding. Oh, me too. And so they just decided, well, let's get together and just talk about it, because, we can learn from each other. And so it's, mothers supporting other mothers in their mothering. And so it since has grown into a worldwide organization. But in 1950s America, you could not print the word breast in the newspaper. And that's how they advertised when they had their meetings, is they advertised in the newspaper, because that's how you advertised everything. There was no internet. And you couldn't print the word breast. And in America, they say nursing, but they didn't want to be confused with nurses. And so someone suggested leche, and they were like, okay, Leche, that sounds French. It wasn't, it was Spanish. So la leche just means the milk, and then league just because it's the la-la-las. So that's how we came to being. So it's a funny name, but it, it's useful. There are people in China. There's been a bit of a difficulty with the government in China about that. There's people in New Zealand. There's people in the Americas. I joined the Spanish language La Leche League group this week, and there were 30,000 members to that group.
Wow, that's a lot of people there.
Yeah. So, but there's a lot of support and a lot of love and a lot of just helping other people out available if you know where to go and know how to seek it out.
Awesome. Thank you so much, Fran, for sharing with us this information. We really appreciate it. Thank you.
You're welcome.
Thank you for listening. I hope that you were encouraged. Please do share this with your friends or family, and do come back for next week's episode. Bye for now.